By the way, it's Doc See Me.
Doc See Me.
Doc
Yes.
See Me. So that's one of the emerging favorites of the doctors that we've interviewed.
Good afternoon, everyone. Again, welcome to the New Normal Business Show. This show is presented by SERVIO Technologies, co-presented by Bitstop Network Service Data Center and MB Tech News. Did you know that 6 out of 10 Filipinos die without even seeing a doctor?
This was in 2013.
Yes, this was in 2013. So I have a voice at the back of my head. If you can hear that. 6 out of 10 Filipinos without seeing a doctor. And today we will talk about our top 3 suggestions in how to in response to the pandemic. But for those who don't know what telemedicine is defined as providing care at a distance, providing health services at a distance. And for those who do not know, the telemedicine market is quite huge. The global market share last 2018 is around $38.3 billion. And if you would see the annual growth rate in the teleconsultation service, teleeducation training service, and telehome market sector, it's around 20% telemedicine. So there's live video conferencing wherein doctors have two-way communication with the patient. There's store and forward or asynchronous transfer. There's also remote patient monitoring. And there's mobile health. So there are different types of telemedicine. During our research, we also done some interviews with top doctors here in the Philippines. So Joey had an interview over the weekend with Dr. Eloy Marcelo, considered the father of telehealth Philippines. So in his interview, some key points were telemedicine technology adoption by the professionals and institutions has increased dramatically due to the COVID-19 pandemic, and this is expected to continue. He also said that a major hindrance to fast adoption has been poor internet connectivity. That's no surprise, but that is no longer an issue here in Metro Manila. And he also said that setting a national EMR or electronic medical record standard should be a government priority. We also did an interview with Dr. Iris Tan. She is one of the top endocrinologists. She calls herself the endocrine witch. She had additional concerns with telemedicine. She says that there's a lack of legislation for the telemedicine. Based on the Medical Act of 1959, telemedicine is technically illegal, but the DOH and NPC issued a joint memo circular to allow this. She also said that there are difficulty in establishing rapport with new patients and problems in how doctors will get paid. And she gave some tips, such as a need for a platform with low bandwidth solutions, have trainings, telepresenter trainings for midwives and nurses, and guidelines for transitioning to telemedicine. If you want to watch the full interview of Dr. Iris Tan, we'll post the link right here in the comment box below. So that is telemedicine, and let's get right to our topic. The top 3 suggestions to telemedicine in response to the pandemic. And I'd like to welcome our speakers for today, who is just going to do just that. So Joey Gurango, our business technology coach, and Wilson Chua, our data analytics wizard. Welcome, Joey. Welcome, Wilson.
Yeah.
3 suggestions. So, starting off with the number 3 suggestion.
Our devices.
Yes, the need for remote patient monitoring. Right? Remote patient monitoring. And of course, there's 2 parts to that. There's the hardware and there's the software. So let's talk about the hardware, or as you say, the devices.
Hello. These are new devices out in the market, and so we're hoping that we're giving away novel information to our audience. So this is the Philips Lumify. You connect it to your smartphone and you have an ultrasound, portable ultrasound. And then Yeah, and then, basic body weight monitoring. There's a weighing scale that's Bluetooth enabled. So it can send your BMI and your weight over to your cell phone, and from your cell phone up to an electronic health record, right? And then here is one thing that's being used right now by doctors that do not want to be in close contact to their patient. A digital stethoscope that connects Bluetooth to your smartphone. So the doctor doesn't have to be physically in front of a patient. The patient could be in another room or in another city. And then this is the one that I use for monitoring my blood sugar. I'm not diabetic, but I've been warned that I am pre-diabetic. So I have one of these. I don't know if you can see it.
I see it, yeah.
Instead of pricking yourself every day, once a day, I can take measurements as often as I want to. And from my sexy assistant, we are not being paid by Abbott. Huh? And let me show you how it works. So this is the app. I put it to my sensor, and here's my reading. It's MMOL.
Nice.
Right. And it can also upload up to the cloud, so you can do longitudinal studies.
And similar device, you actually have a wearable heart rate monitor. I see here.
Right. So it can monitor your heart rate, and there are newer models that are supposedly able to also monitor your blood pressure. Wearable, like this one.
Yeah. Etong very popular na ito among doctors, yung pulse oximeter.
Right.
So now they have a pulse oximeter which can transmit via Bluetooth to your phone.
Where's our pulse oximeter? So you've seen my pulse oximeter, right? Especially with COVID. Sometimes they say that even if you're asymptomatic, what happens is the only way you know is if you put it here, your blood oxygen saturation would be 94 and below, right? And what else pa? Blood pressure.
Blood pressure monitoring.
Yeah, so all of these devices taken together allows a patient to recover at home where the quality of life score is higher, right?
The question is, who pays for this stuff, man?
That's one of the questions raised by Dr. Iris in our interview. Who pays? So I guess one of these days, somebody's going to set up a new business model in the same way like, Airbnb and Uber came up with sharing of extra, the spare bed, the spare car. Maybe there's also a similar business model that will crop up in the future.
Matter of fact, maraming mga local apps na ginawa for mobile devices, right?
So yeah, basically you have all these apps, they're collecting data. Where do you send those data to? Right? So it has to be collected somewhere so that one day data analytics can be done and give you targeted precision medicine. So your outcome is better.
So the apps that we're showing here are StaySafe.ph, which I think has been endorsed by the IATF as the monitoring app of choice. There's Clear. There is the Red Cross's RC143 project
made by the ex-Chica guys.
The RC140 is by the ex-Chica guys. And of course, there's Curve. And Curve, of course, is from our company, SERVIO Technologies. It is free. But that is also another health monitoring and recording. Number 2.
So our number 2, according to doctors that we've interviewed, is the need for, EMR, electronic medical records platform. Something
EMR
that
digital patient
and health records. Yeah. So it has to be able to work in a low bandwidth environment, considering that the Philippines has a relatively poorer internet penetration and coverage. Yeah.
There's actually quite a few fairly popular
Mm-hmm.
applications that cater to digital uh, patient records, like Doxime, right?
Yeah.
And Serious MD and Medify.
Yeah.
I mean, these apps all have different functions, but at the core, they allow you to store your patient and health records in the cloud.
Mm-hmm. By the way, it's Doc See Me.
Doc, see me.
Doc
Yeah.
See Me. So that's one of the emerging favorites of the doctors that we've interviewed. Mm-hmm.
The question though is, and since a lot of these systems are actually been implemented and deployed by institutions, so
Mm-hmm.
you actually have three parties involved here, right? You got the patient, you've
Mm-hmm.
got the healthcare provider or the physician,
Mm-hmm.
and you have the institution. The
Correct.
question I keep hearing about patient records when it comes to digital records is, who owns
Owns the
these
record.
records? Sino
Yeah.
nga ba? Sino nga ba?
So no, because some doctors treat the patient records and the treatment protocols as some sort of a secret sauce, right? So
Are you
so
saying that these doctors are claiming or suggesting that they own the patient data?
yes, that's what
Yeah, there's actually quite a few bills in Congress already
pending. Yeah,
pending that has to do with telemedicine and the
healthcare and
healthcare.
and the use of ICT to advance healthcare.
Do any of these address the issue of ownership of patient records?
Uh, Curiously, I haven't seen it be
Let
so.
me ask you this: given that there exists already the Data Privacy Act, don't you think that this particular area is governed by the DPA, and that patient records, in fact, are a form of personal information, personally identifying information, which is protected under the DPA?
We know it's protected, so but the question of ownership is the one that's in question
So
because
iba pa
who
yun.
so
Iba
if I
yun.
own the record, I can migrate, I can port my records to any provider I want. But if the doctor owns my record, pahirapan kumuha ng kopya for a second opinion or a third opinion.
As far as these records, once they're actually in the cloud and they're digital, you can now apply big data,
Yes.
right?
Yes.
Diba?
So you can see big data when you apply it properly further improves the medical outcome. You know, targeted precision medicine. You can spot errors before it happens. You can help hospitals save on cost by assigning proper staffing or workforce alignment. A lot of things you can do. Some of the more mundane parts can be automated, right? And I'd like to showcase what we did for one of your babies, Kerr, right?
Yes.
So if you see the data, so we took some of the data from Curve and looked at patient comorbidities. So this part is fairly well known. If you are obese, you also stand a higher chance of getting diabetes and cardiovascular problems.
Yeah,
And this is
and
what you see in the Curve
also
data.
you used Neo4j for this, right?
Yes. So Neo4j is a network graph analytics program. It has both a free and a enterprise version. So for this, we just use the free version.
Suggestion.
Mm-hmm.
I think it's time for us now to go to our number one suggestion for telemedicine in response to pandemic. And I think this one's quite obvious for a lot of people, but we just want to highlight the importance of number one suggestion for
Ta-da!
telemedicine.
Drum roll.
Drum roll. And that is number one, remote
Consultations.
Yeah.
Yeah. So
So
by
when we talk about remote consultations, what we're really talking about for the most part is what we call, we have a graphic here showing, and this was done by the way before COVID.
before COVID.
BC pa to. BC
Mm-hmm.
pa to. And
Mm-hmm.
it shows us the study done by United Healthcare and
About the
why.
relative advantages
Yes.
or why
Why
people prefer virtual doctor's visits. Yeah.
Right. So it shows that, first of all, virtual doctor visit saves time.
Yeah,
Uh,
106 minutes.
yes, it saves time. Secondly, availability. You can
Yeah,
actually,
24 by 7.
yes, and it should cost less because
And
walang overhead, right?
yep. Mm-hmm.
And 91% of the outcomes can actually be diagnosed virtually. It doesn't need to be done for them. Okay, now, it's really
And
funny, Wilson, but you have been, shall we say, the object of this particular experience lately. Tell us about your experience there in Singapore
so
actually
so I
doing this.
so in Singapore, I think the government has a very smart move. Uh, if they can help their citizens manage their chronic illnesses, it will not escalate to the point of requiring hospital. In Singapore, I will get biannual notices to go to the hospital and get my annual blood work done.
Right?
So there I go. And then usually it's 1 week later, I get to see a doctor that goes over the results of the blood test and whatever treatment protocols are required. But this time, because of the COVID, the nurse was kind enough to say, Mr. Chuad, would you like to avail of the online visit? So you do not have to come in and queue and all this stuff, you know. I said, of course I want.
Yes. So you
Of course.
agreed. You
So I
agreed.
agreed. And so the doctor, so here we're showing the actual, he discussed with me the results of my test while I opened my electronic record online via browser. So the
So
electronic,
this is your EMR on a browser, right?
yes, yes. And so there are several options. So I click on the lab test results. So after clicking on the lab test results, I see the next screen, which is the actual lab tests that were done to me. And if you click on it, it will show up all my results. And that was
So
the
that's
Singapore
your Singapore
experience.
experience. Let's take a look at a local experience, naman.
So
What's the,
I took the opportunity of calling up our doctor friends in Dagupan, all the way from Pangasinan, Dagupan City. Um, Villaflor Hospital is one of the leading edge hospitals in the area. And I talked to Dr. Vivencio Villaflor, Juvie, as is well known, to ask about the hospital experience. So because of COVID, a lot of their patients are hesitant to go to the hospital for fear of picking up COVID. So the
yeah,
hospital innovated and adapted to the times by offering online consultation. So they have an omni-channel called Villaflor's Hello Doc. So you call it
hello,
up
doc.
either
Hello,
by
doc.
Hello Doc. So
Hello,
either by
doc.
phone, SMS, Viber, WhatsApp, and it lands in a triage nurse that will then ask for your symptoms and connect you to the appropriate doctor on call. Yan. Now, once it gets to the doctor on call, the doctors there also uses Doxini.
Docs.
Surprise, surprise. Yeah.
Okay.
Now,
So how far can you be from the doctor for this?
so if it's virtual, you know, I could be in Singapore and avail of Villaflor Hospital's services. You know,
Exactly.
this distance is not an issue anymore.
Exactly. So technically, even if there are patients outside of Pangasinan, in outlying areas where maybe there is no doctor available
Mhm.
to them locally, they can use this,
As
right?
long as they have either internet, SMS, or telephone service, right?
Exactly.
Now, they went
Hello,
one
doc.
step. They went one step further that Singapore did not have. Remember, I
Okay.
had to go to the hospital to get my blood work done, right?
Yes.
So they have this other service called On the Go.
On the go.
On the go. You call them up, they go to your home, and they take your urine or blood or whatever lab test you need. You don't ever need to leave your home because in Dagupan there are series of checkpoints, and there are intra-city, intra-province checkpoints. So you can't really travel easily from your house to the hospital. So in
Okay.
this case, they're the ones who go to your place. So we took the data that were collected by volunteers or projectbash.org. This is one of our advocacies. And we took a look at how far the health centers were from their nearest cell site. And we also took a look at that cell site and measured the median bandwidth. And then we aggregated that by region. Turns out, sir, what Dr. Marcelo was saying is now backed up by data. Internet connectivity for the hospital is not the problem in NCR. So you can see the huge green line showing the large medium bandwidth available on the average to hospitals in NCR. And then
it's not a problem with NCR, but where is it a problem?
ARMM.
ARMM. No,
Soxargen, Eastern Visayas, Cordilleras. So these are at the bottom.
But it just so happens that last week when we were talking about distance learning, even the schools, especially public schools, then those regions are the same ones that did not have good connectivity.
But so people have been advocating for the open access bill that we talked about in other episodes, and now being championed by Senator Ralph Recto.
Yes.
I hope that open access bill passes. So going back to the other chart, we can see a very specific distribution of bandwidth by health centers. And you can see that almost 65% of all health-related centers have bandwidth below 5 Mbps.
Which is not sufficient. It's not sufficient, right?
Well, it's sufficient if you are a single practitioner. But, once you are in a multi-practice clinic or larger hospital, you need to go up to the 80 meg, 100 meg, even 1 gig. So we took a look at the link provided by Dr. Iris. Apparently, they're giving away the free courseware from the medical informatics unit, and they have recommended minimum bandwidth for different types of healthcare, which we have reproduced below with their permission. Yeah.
But let me tell you, I mean, if we had adequate bandwidth as being prescribed here, I wonder when it will be that someday we can achieve the dream scenario for telemedicine, diba? The dream scenario, which I have a slide here to show a picture. This is the dream scenario for telemedicine technology, to be able to perform surgery remotely. Yes. But since we're talking about remote consultation, I think it should be clear to our audience that remote consultation does not require some kind of specialized proprietary telemedicine software or applications. Okay, there are now many general purpose business tools that can be used for remote consultation.
Even free.
Even free. Your options are not limited to proprietary, expensive, or hard-to-use technologies. Okay, many of them are general purpose and even free. So, for example, there are free consumer-oriented tools like Skype and Facebook Messenger.
Google Meet.
Okay, this is consumer-oriented, of course, which means that if you want some of the management features, business management features, or professional features, wala yan. Pero libre yan. So, syempre, maganda siya. Okay? There's also the business and professional-oriented tools like Zoom, right? WebEx, and even Microsoft 365 Teams. Andyan din yan, okay? These are professional or business tools, so they can be used in a professional practice, okay? These are all tools that are available now, very general purpose. Okay?
Yep.
They can be used for remote consultation and even to run your practice. Now, finally, there are also business and professionally oriented tools that are available for free, believe it or not. The leader in this category right now is something called Google Meet. If you've not used it already, this is a free application from Google, okay? And we all know that Google produces very good software and applications, okay? Full disclosure, okay? We do not have any ownership in any of these tools except for the one I'm about to tell you. An alternative to Google Meet is a tool called Lark. Now, this is a business and professional tool that is totally free, okay? But unlike all the other tools that I mentioned, LARC is supported and maintained in the Philippines by SERVIO Technologies, a 100% Filipino-owned company. LARC fulfills our advocacy of providing software pang negosyo abot kaya ng Pilipino. So if you want to get LARC
Galing.
free, if you want to get a free copy of LARC, you can simply go to larkfromservio.com. Again, that's larkfromservio.com, and we'll provide you with a free copy of LARC. Okay?
Great.
So I think that's kind of all the time we have. We're running out of time, Wilson. So maybe we can just do a little bit of wrap up. Why don't you go ahead and wrap up this conversation about the top 3 suggestions for telemedicine in response to the pandemic?
So we have the devices and IoT that enables us to collect patient data. And then we have the software where we can store the patient data. We have big data analytics that can help analyze and provide better outcomes. And my wrap up is to thank people that helped us with this episode, Dr. Vivencio Villaflor, Juvie, and Dr. Iris Tan, that I reached out to, and Dr. Eloy Marcelo that you interviewed, Joey.
Yes. And let me do my wrap up. I mean, I just want to close by saying that this COVID-19 pandemic has forced many businesses to close down. Many businesses. Most of these bankruptcies were traditional physical businesses, while most of the survivors are the more modern digital businesses. Now, the digital maturity model is both a framework and a roadmap for digital transformation that we develop for growing businesses. We developed DMM based on our observations of and working experiences with hundreds of SME owners and managers who have attempted to implement technology solutions into their businesses. SERVIO Technologies utilizes DMM in developing technology solutions and tools that have accelerated the digital transformation journey of many Filipino companies. We predict that any SME that does not have a digitally enabled workforce by 2021 will be extinct. So don't be extinct. Survive and grow by learning how to become a digital native at www.businesstechnologycoach.com. That's www.businesstechnologycoach.com. Thank you very much.